Kinley. I'm going to be your nurse today. The doctor has ordered for me to put in a urinary catheter before your surgery, and this is just so we can keep up with that urine output. Alright. Can I go ahead and get you to verify your name and date of birth? Alright, great. And do you have any allergies such as betadine, iodine, or latex? No? Awesome. Okay, so I'm going to begin by providing some perineal care before the surgery. I'm going to go ahead and let this blanket down, and I'm going to have to pull your drape up just a little bit. And my patient needs to be placed in the dorsal recumbent position, which is very difficult with this mannequin, as you can see. It just does not want to go into that position, but we're going to do the best we can. Alright, so I'm going to begin by placing this towel over her. Okay. Alright. Alright, so I'm going to begin by, I'm holding the vagina, and I'm going to wash from up to down. This is just to prevent any infection. So I'm going to start with the right labia, go down. I'm going to use a different part of the rag and do my left labia, go down. Use another part and go straight down the meatus. Alright, okay. Now I'm going to get another rag and I'm just going to pat her dry. Alright. So now the perineal care is completed, and I can go ahead and take off these gloves because I'm about to have to put on my sterile gloves. Alright. So I'm going to want to keep this close to me at all times because I want to keep an eye on my sterile field. I want to make sure nothing breaks my sterile field, because if it does, it could lead to serious complications such as infection, sepsis, UTIs, and so forth. Right, and I'm going to use this bag as a little trash can. And I'm going to place it on the end of the bed so I can easily access it. Okay. Alright, so I'm gonna, okay, and again, I don't have much working space here, so it's gonna be very hard for me not to break the sterile field, but I'm gonna do the best I can. If it was an actual patient, she could go into the dorsal recumbent position more easily. Okay, so I don't want to lean over my sterile field, and I want to touch the very ends. Oh. See, not much room. Okay, touching the very end. Okay, then finally touching the very end. Okay, this shouldn't be touching the vagina or anything, but yeah, not enough space. So I'm going to go ahead and begin by donning my sterile gloves. Again, I'm going to do it right here. I have my sterile field in sight. Alright, so I'm going to begin by just placing my fingers under here. Pull. Okay, this glove came off. It was not supposed to do that. These were not put in properly, but basically I do not want to touch anything but the borders of my sterile, the borders, because everything else is sterile. And these just weren't packaged properly for some reason, but okay. So everything in here is sterile. So I want to keep my hands high above, and I want to begin by just grasping the wrist and pulling my hand on in there. Okay. Now I'm going to go under the cuff here and just pull that right on in there. So, okay, I got my sterile gloves on. So I'm just going to move this out of my way. Alright. Okay, so this is going to provide her a little extra sterilization. Okay, and okay, as you see, my fingers are touching her legs. That is not sterile. That's not supposed to happen, and it would not happen if she could go into the dorsal recumbent position and I had more space to work with. But I don't. So for the purposes of this video, I'm just going to place this right here like this so I can have some space to work with. In reality, if this was a real patient, I would not want to touch her legs or anything outside of this sterile field right here. Okay, so just clearing that up. All right, so I'm going to go ahead and separate this. All right, so I'm going to begin, well, I'm going to want it this way. Okay, so I'm going to begin by placing my lubricant in. Okay, and once that's placed in, I'm just going to drop it. I'm going to make sure I drop it from high up because I don't want to infect my sterile field. All right, and now I'm going to go ahead and test my catheter by inflating my balloon just to make sure it is working properly and I don't need to go get a new one. Okay, so I'm just going to inject just a little. Okay, and my balloon is working, so I'm going to go ahead and pull that out, and I'm going to leave my syringe in there, and I'm just going to let my hand just touch my arm. That wasn't supposed to happen, breaking sterile field. Okay, and I'm just going to let the end of my tube, just leaving it in the lubricant if it would stay in there. Okay, all right, so I'm going to go ahead and place this iodine on my cotton ball so I can begin with her vagina cleaning. Drop that in there. Okay, this does not want to sew. Okay, all right, so my hand is now touching the vagina, so my hand cannot leave this position anymore. It is unsterilized. It's got to stay right here. So I'm going to begin by first, I'm going to begin with the right meatus. I'm going to go down just like the previous procedure. Toss it in my bag. I'm going to start with the left meatus, go down, toss it in that bag. Okay, then I'm going to go right. I meant to say labia, the right and left labia. Okay, now I'm going down the meatus. All right, place it. That wasn't supposed to fall. Place it in my bag. Okay. This should be placed right back in my bag too. Okay, so now that that has happened, we can go ahead. I'm going to keep my fingers 2 to 3 inches from the tip. But I can't really do that because it's kind of hard to get this in this mannequin properly. So in reality, it should be 2 to 3 inches. But for this mannequin purposes, I'm going to have to get a little close. Alright, so I'm starting to see some urine output. So I'm just going to put it in 2 to 3 more inches. Alright. Okay. So now I can go ahead and insert my 10 cc's. Alright, and now I'm going to pull back till I reach resistance, and I have, so it is in properly. Okay, I'm gonna go ahead and take this out. I'm gonna need to use this again later, so I would normally place it into my trash can, but since I need it later, I'm just gonna place it right here on the table. Okay, so I'm gonna go ahead and tape this to the side of her leg for comfort. Okay, this tape is getting stuck. Okay, and I'm going to, the urinary bag should always be, okay, stay. Okay, that should be securely placed. So, since it is not, I'm going to get one more piece of tape just to ensure that this stays secure. Okay, now it is. So, once again, the urinary bag should always be below the bladder, and it will need to be placed on the bed frame, not the side rails. All right. Okay, and if I were to, if I needed to get a urine sample, if I needed it right after the procedure, I could just get it from the urinary bag. But if I needed it, you know, a couple of hours later or a couple of days later, I would need to get my syringe and I would need to go to the port, disinfect it, and then just put my syringe in there and get the urine sample. Okay? All right. So now that she's all done, I can go ahead and clean all this up. I'm gonna place this in the trash can. I don't have one, so I'm just gonna place it right here. All right. Okay, and I'm gonna go ahead and lift both these side rails. My patient's in privacy. This side rail. Okay. All right, so I'm leaving the room. She's okay. Hey, hi, how are you? The doctor has ordered for me to take out that urinary catheter. Can I go ahead and get you to state that name and date of birth for me one more time? All right, great. So I'm going to want to go ahead and put these side rails back down. And I'm going to want to also empty my urine bag. So emptying the urine bag, okay? Okay. All right. So, I need to take out the 10 cc's that I had originally put in there. I'm going to go ahead and put this right here and pull it out. All right. Now that I'm going to put this in the trash can. Okay. Go ahead and take this off her leg. Okay, and I'm going to get really close to her and I'm going to pull this out slow and gently. I'm going to ask her to breathe. So please take a deep breath for me. And we're doing this slow and gently because we don't want urine splashing everywhere. All right, and now I'm going to ball it up in my hand just like this. Again, because we don't want urine splashing everywhere. All right. Can go ahead and place the drape back down, cover her back up, and at the end I would want to note how much urine output she had and notice any abnormalities such as color and things like that. All right.